Okay, we're gonna go into sitting posture. So this is gonna be your first exercise. You're not going to do this every time you're sitting. You're not gonna try and hold this posture. This is something that it is an exercise. So it's done in short amounts of time, in small increments over the day. Maybe if you wanted to every hour or so, do this 30 seconds to a minute. That would be a good way to start introducing these tensions into your body. If they start to feel really uncomfortable, stop. And then, revisit it at a different time, especially if you're really stressed out. Probably not the best time to start this. So just wait, go back to it when you feel like it. So we're gonna start in a nice harder chair. So a nice harder surface, probably your desk chair would be perfect for this, your dining chair, whatever you have. You can use the back of the chair also as some feedback. So you can see most people are going to be in a little bit of a flexion. So you're going to be a little bit away from your chair. So having a video monitoring or a mirror would be helpful also in the first couple times that you start engaging in this exercise. So from here, we're going to think about our pelvis moving forward and backward. So from what we call anterior to posterior pelvic tuck. You can do this with pretty much no muscular contraction, or you can use these tight, short muscles down in your pelvic floor, contracting them, getting them shorter, drawing your pubic symphysis, your pubic bone, up to your belly button. So you're trying to shorten the space between your belly button and your pubic bone. Pulling that in, you should feel a small contraction here in your abdominal muscles. You're going to use that to start stacking the rest of your body on top. So you have to build a foundation, then we can start stacking the rest of our bones up and over this point. We're going to pull that belly button into our spine, pulling our ribs into our spine. You can see that starts to drop my chest down. From there, I want to take my chest and pull it up. So I'm trying to get my sternum from pretty much facing forward to facing up at a 45-degree angle towards the ceiling. As I do this, you're going to see my back's going to want to start to extend with it. I don't want spinal extension. I just want thoracic extension. So you see how much tension I'm having to hold into my core, and I can start getting my chest up and away from myself. In this position, you're probably going to be a little bit in this forward flexion state still. So you're going to want to use that mirror to draw yourself back and into what is a real sitting neutral. This might feel really uncomfortable and feel like you're almost falling backwards for some people. That's why it's going to be the exercise. It's going to take you out of where you're normally sitting and putting you into a more neutral position. So you should feel a lot of contraction here. You should feel some contraction around your ribs, and you really should feel this stretch through and around your scapula, around your shoulder blades as you start to open and extend that congested area. This is the area that when you're forward folded is taking most of that tension. So all of this is working to get you up and out of that cast that we've been trying to explain. So just start at the start. Each piece, build on top. Don't just try to jump into this all at once. Let yourself find the tension, build the tensions up and off. Hold that position 15, 30 seconds. You'll see it gets easier as you start to find what parts of your body are holding more tension or what places don't want to actually open up and get that extension. So just use this as an exploration. Try that a couple of times a day and we'll keep evolving it, I guess.